Good day, dear students. Today we'll start cycle of gerontology, and our topic is the concept of gerontology and geriatrics, and also integrated care for older people. And we'll start with gerontology. Gerontology science dealing with the study of the process mechanisms of aging is biological, medical, psychological, and social aspects. So it is science about aging, which include many different processes. It is not only about disease in aging. About disease in aging, we'll discuss later. Gerontology include many aspects, which are mechanisms of aging, its biological, medical, and psychological and social aspects. And I want to tell you 8 periods of human life according to World Health Organization. Up to 44 years old, we call person young. Don't tell please that if patient is 40 years old that he is older person. No, he is young. Age 45 to 59 is average. Up to 60 years, average age. 60 to 74 years, elderly, and more than 75 years, up to 89 years, senile age, and over 90 years, long lives. Really, the most advanced time of life is around 120 years old. And we have in our world few persons who lives longer than 100 years old, up to 120 years old. But mostly life duration is shorter. The tasks of gerontology are to preserve mental and physical health of older and senile persons, maximum activity and independence of elderly and old person, social well-being, and dignified and to life. So, task of gerontology, not only treatment, it is well-being in many aspects, activity of persons, well-being of persons, and good health of person, of course, as possible as nice as it possible, have to be health status in older persons. Now our population became older and older. That's why these problems became very important. Gerontologists include researchers and practitioners in the fields of biology, nursing, medicine, criminology, dentistry, social work, physical and occupational therapy, psychology, psychiatry, sociology, economics, political science, pharmacy, public health, and housing. So you see, it's not only doctors and nurses. There are social workers, there are criminologists, there are psychologists and other specialists. So gerontologists are many specialists. Directions for the development of gerontology. Development of approaches to the treatment of disease occurring mainly in old age. It is mostly our task for doctors. Ensuring the highest possible life expectancy. I already told you that ideally, person can live more than 100 years, and we are trying to increase life duration. Organization of medical and social assistance to the elderly, and also pension problems. So it should be not only medical problems, it include assistance and uh, payment. So it is not only medicine, gerontology. What is aging? Aging is age-related changes that limit the adaptive capacity of the body and lead to old age. And all of us have aging, and with more long life duration, we get more problems, and everybody will have it. That's why it is very big problem, and we have to resolve it. Aging is characterized by decreased in adaptive capacities of the body, decreased ability to produce offspring, increased likelihood of death, polypathy, three or more chronic disease. There are endogenous and exogenous factors of aging. Endogenous factors of aging: auto-intoxication with products of cell metabolism. Exogenous: environmental influence, stress, intoxication, unbalanced diet, physical inactivity, infections, and trauma. There are many theories of aging. One of the most famous group of theories are molecular genetic theories of aging. The hypothesis that the cause of aging is changes in the genetic apparatus of the cells is one of the most recognized in modern gerontology. So we think that our aging is programmed in our genetic apparatus, and changes in chromosomes will lead to older aging of persons and even to programmed death. Molecular genetic theories fall into two large groups. Some scientists consider age-related changes in the genome as hereditary programmed. Others believe that aging is the result of the accumulation of random mutations. Hence, it follows that the aging process can be either a natural result of the growth and development of an organism or a consequences of the accumulation of random errors in the system of storage and transmission of genetic information. So, aging may be programmed, according to scientists, or may be occasional due to random changes in the genetic apparatus. I choose only few theories to show you because I love this theory more. And my favorite theory is telomeric theory by Olovnikov, Mr. Olovnikov. The main feature of this theory: cell division leads to shortness of telomeres, ends of linear chromosomes. You see it in red color. Therefore, with aging, cell lose the ability to divide and die. There are many telomeres at the end of the chromosome, and each division leads to disappearing of one of these parts. When all of them disappear, uh, cells cannot divide it anymore and die, and patients die also due to some organ insufficiency. Another theory, stochastic probability theories. According to this group of theories, aging is the result of a random process at the molecular level. Many researchers believe that aging is a consequence of the accumulation of random mutations in chromosomes as a result of the wear of DNA repair mechanism, the correction of errors during its copying during cell division. No, we already discussed these probability theories. And what about real life nowadays? The average life expectancy in the world in 2015 was 68 years. In 2023, 73 years. You see, in the world, life expectancy during these less than 10 years increased by 5 years. So it is mostly due to medicine, I feel. But maybe different reasons for this increasing duration of uh, time of living, and our task is to help persons to live longer. Human life expectancy depends on lifestyle, mostly lifestyle. And now, mostly people aware about healthy lifestyle. For example, it includes physical activity and diet. And for example, Mediterranean diet is commonly recommended to people because more long time of life, more the biggest life expectancy present in Japan and also in Mediterranean countries like Spain, like France and Italy. So this diet give very good effect of health status. Also, 20% depends on ecology, 10% on genetic, and 10% the level of medical care. No, and for us is important level of medical care. It doesn't affect too much, but may improve quality of life. And also, we have to recommend persons healthy lifestyle because it is very important. You see it. The concept of age of a person. Maybe two types of age: calendar age, the number of years lived, and biological age is a measure of the aging of an organism, its health, and future life expectancy. So, biological age may be low or higher than calendar age. And if person has low biological age, it means that older person looks like moderate age. And if biological age is high, it means that young persons looks like old one. And if aging process uh, is normal, we have physiological aging. What does it mean? Means good health, interest in modernity, optimism, active communication, sufficient motor ability, and self care. So all these problems may be in persons with non-physiological aging, decreased motor ability, depression, and bad health. Premature aging, syndromes of decreased adaptation, asthenia, immunodeficiency, decreased interest in life, lack of communication, low health, illness, restriction on movement and self-service. And our problems like doctors is low health and illness. And for this task, we have another topic. It called geriatrics. Geriatrics is the area of clinical medicine that studies disease of elderly and senile people, development methods of their treatment and prevention in order to preserve physical and mental health a person to ripe old age. So geriatrics is area of clinical medicine that studies disease of the elderly. Uh, of course, there are no absolutely specific for old age disease. Mostly they have the same disease, and this disease started even in moderate age. But The clinical course of this disease may be changed. Predisposition to this disease may be different. And symptoms also can vary in young and old persons. There is no definite age at which patients may be under the care of geriatrician or geriatric physician. Geriatric care may benefit those who are managing multiple chronic conditions, multi-morbidity, or experiencing significant age-related complications that threaten quality of daily life. So, whom you can send to geriatrician? You will send elderly persons. There are no worldwide definition in which age you will send person to geriatrician, but mostly it is persons. There are persons above 60 years old, but some persons above 60 years old has physiological aging and has good health status or mild disease. In this case, they don't need geriatric physician. But in case of multimorbidity, especially in persons over 70 or 80 years old, and age-related complications which threaten quality of daily life, you have to think about treatment of this person in a special division or in special doctor, which call geriatrician. And geriatric medicine usually includes not only treatment but care with elderly person. And I want you to list you most common geriatric syndromes. Geriatric syndromes, there are list of syndromes, but more common are few. First one is frailty. Frailty may present as progressive and unintentional weight loss, exhaustion, muscular weakness, low physical activity, and slowed walking speed. So all organs in older persons are affected due to decreased metabolism with aging. There is one more hypothesis that aging depends on of our endocrine glands. First of all, thyroid and parathyroid gland secretion. But in this case, all no, but not everybody believes to this theory. But it can explain us why all organs metabolism decrease due to a low endocrine system function. And frailty is, first of all, a definition of low function of musculoskeletal system. It is due to so-called sarcopenia, muscles wasting. In this case, patient became weak. If older persons may, you see, at the same age, older persons may move, may be active. Another move more slowly and uh, to move to less distances, and the third group cannot move at all due to joint pain or due to muscle wasting. So we call it frail persons. Another geriatric syndrome called functional decline. Functional decline serves as a qualitative measurement of function over time and predicts the needs for alternative living arrangements or models of care, including senior housing apartment, skilled nursing facilities, palliative, hospice, or home-based care. So functional decline means that older person and see, a new age person cannot do everything for himself, themselves. He need care, not or medical care. He need help. And functional decline divided to two groups: basic activities of daily living and instrumental activities of daily living. Both may decrease with aging. Basic activities of daily living include feeding, personal hygiene, toileting, transferring, and ambulating. Instrumental activities of daily living include cooking, housekeeping, managing one's finances, and medications. No, mostly older persons start with decreased instrumental activities of daily living because they need more forces and more mental activities. And it is difficult for them to cook, to manage one's finances. And what is important for us to remember that it is difficult for them to take prescribed medication. When you see elderly persons, you should no, you should keep in mind that they can forget about medicine. And there are different ways to help their adherence to regular medicine, not decrease dose, not miss taking of the drugs. In severe situation, in senior persons, you can contact with their relatives or maybe hospitalized patient to skilled nursing facilities to help them to do basic and instrumental activities of daily living. And for medication, there are some ways to improve adherence. For example, this one patient may put tablets in different places which is specific for evening, morning, and afternoon, and for each day of the week. Maybe not patient will put medicine to these boxes. It may do nurse or some relative. So you should remember that older persons need help with with taking prescribed medical medicines. Next common geriatric syndrome called falls. It is very big problem. We have even guidelines for fall, how to manage and how to prevent falls in elderly. Because falls have a high risk of trauma or fracture in elderly persons, and it leads to the disability and decreased activities. Certain risk factors can be identifiable for the purpose of reducing falls. It includes improving balance and muscle strength. You shouldn't recommend older persons don't move. Let them move as much as they can, as much as it's comfortable for them. They shouldn't be in the house all the time. Let they have some daily activities. Go for a walk or go to some shop or to buy something. They have to do something because without this movement, the sarcopenia will develop very significant and they will have very low muscle strength. Uh, to prevent falls, you should remove environmental hazards because, for example, in the flat may be some problems with tables, with beds. Person, especially at night when he doesn't see, it may have contact with it and fall due to these contacts. Encouraging use of assistive devices. Of course, better to use sticks and other assistive devices if it is need. Patients shouldn't be ashamed to take these assistive devices. You have to explain them that it is very important and falls are very dangerous for them. Treating chronic conditions, of course, and adjusting medication. Another common geriatric syndromes include urinary incontinence and malnutrition. Urinary incontinence is defined as unintentionally urinating on oneself. Uh, so it is big problem. Person may not tell you about it because they are afraid to be so unhappy to show that they are so older. You have to ask them active and polite about a urination problem. These symptoms can be caused by medication that increase urine output and frequency. For example, diuretics, especially loop diuretics. So, very common in older persons present chronic heart failure, for which we usually use diuretics. And in this case, you have to remember about urinary incontinence and discuss with person and with their relative about this problem. In this case, maybe more low dose of loop diuretics or some other ways to protect incontinence. Also, urinary tract infection is very common reason for urinary incontinence. Even in moderate age, it can lead to urinary incontinence. Pelvic floor dysfunction present due to muscles wasting, total muscles wasting. Pelvic floor dysfunction is also common in older persons. And disease that damage the nerves that regulate bladder emptying. It is fortunately not so frequent, but urinary incontinence is a very big problem in older persons. Malnutrition. It seems to us that now there are no poor people which have malnutrition. We all have enough money for food. Maybe not for cars, for advanced device, but for food seems that everybody have enough money. But elderly, even with enough money, may have malnutrition, which can occur due to a combination of physiologic and pathologic uh, and psychologic and socioeconomic factors. And physiologic factors include some problems like reduced smell and taste, and disease and decreased metabolic rate. It is a normal situation in older persons, but in this case, he doesn't want to eat, and it can lead to malnutrition. Pathologic um, factors include poor dentition, gastrointestinal cancer, gastrointestinal reflux disease, and other gastrointestinal problems. And very common problem is poor dentition. So in this case, patient has problems with chewing, and he tried to swallow. It will lead to constipation or diarrhea, and person start eat less to for prophylaxis of this complication, and malnutrition develops. No, and if patient has dementia, which is also a very common problem in older persons, he may even forget about eating. And and a more rare situation, of course, uh, poor persons who has not enough money. It also still present in community even nowadays. How does looks patient with malnutrition? This patient has dentition problems and dementia, and for in this case, he cannot eat himself. He doesn't want it himself, and he is in the nursing house, and he is feeded by this tube, which is put it into the stomach, and solid and not solid. Watered food is put it inside the stomach directly. And we have to remember that Geriatrics is highly interdisciplinary, consisting of specialty providers from the fields of medicine, nursing, pharmacy, social work, physical and occupational therapy. So, geriatrics is a very broad spectrum uh, and because patient has many problems, older person has many problems. It is not only health person, and even in health problems, there are many health problems because of multi-morbidity, and also maybe social problems and problems with social well-being. Elderly patients can receive care related to medication management, pain management. Pain also is one of the main problems in elderly persons due to mostly joint pain. Psychiatric and memory care. Also, common problems in elderly persons is mood disturbances. Rehabilitation, for example, after fracture, after stroke. Long-term nursing care. I showed you a person who is who need long-term nursing care, who has dementia and movement problem and dentistic problem and many other comorbidities. Nutrition and different forms of therapy, including physical, occupational, and speech. So, persons have many problems and specialists in gerontology have to resolve all of them. Non-medical consideration include social services, transitional care, advance directives, and other legal considerations. So, gerontologists have to have contact with social service, with other specialists. And I want to show you pictures with different examples of geriatric care to explain you that geriatric is not easy specialty, that geriatrician have to know a lot because their patients have many problems, and usually one doctor cannot have resolve all patients' problem. There have to be team with which include different specialists to treat only one elderly person. The care provided is one largely based on shared decision making and is driven by patient goals and preference, which can vary from preserving function, improving quality of life, or prolonging years of life. Frail elderly people may choose to decline some kind of medical care because the risk benefit ratio is different. All elderly people need many types of care, but overcare is also not comfortable for a person. That's why decision about care have to be made by both, by team which include many specialists and also older person and maybe their family members to choose the best direction in which this help need first or patient need help first of all. In this case will be the best effect of care. Geriatric providers receive specialized training in caring for older patients and promoting healthy aging. The domains are cognitive and behavioral disorders, medication management, self-care capacity, false balance gaze disorders, atypical presentation of disease, palliative care, hospital care for elders, and healthcare planning and promotion. So, to become geriatrician is not so easy. Usually, it is general practitioner who underwent some special training as a rule, 1 2 years it takes because there are many special problems in ordering. And after doctor finish these courses, he have to underwent exam and answer to many questions, which include cognitive and behavior disorders, how to use medication. Usually, we have to give more low dose of medication for elderly persons. You will discuss about it in future lectures. About you. Geriatrician should know about a typical presentation of disease, usually low symptoms severity, not which mask uh, clinical cause of the disease or atypical clinical symptoms. You also will discuss it in next lectures. And you geriatrician also have to know about palliative care and hospice and indications for hospitalization in elderly. And he have to know about healthcare planning and promotion. Geriatricians are geriatric providers, may be in polyclinic and may be in the hospital. And it depends on country where mostly work geriatric providers. And they in United States, for example, they treat mostly outpatient. And in United Kingdom, mostly the specialists are in the hospital. So it depends. But all countries now have geriatric providers and have courses for training of students and doctors to become specialists in this field. No, and here you see young persons students who wants to be pediatric specialists. And you see all of them should be very uh, polite, very high level of specialist and kind person to give good help for older person. And we all have to remember that mostly we became older and we all will have similar person problems which has our patient now. And in next part of the lecture, I will show you faces of older persons to show that they are very important, interesting, and famous people, and you shouldn't forget about it, and you should pay attention. Even if you are not geriatric specialist, you have to pay more attention for older persons because they have more problems. Geriatricians have developed an expanded expertise in the aging process, the impact of aging on illness pattern, drug therapy in seniors, health maintenance, and rehabilitation. They serve in a variety of roles, including hospital care, long-term care, home care, and terminal care, also very big problem. The model of care practiced by geriatricians is heavily focused on working closely with other disciplines such as nurses, pharmacists, therapists, and social workers. And now let us have 5 minutes of break and then we'll continue our lecture and discuss integrated care for elderly people. Organization of care for elderly people. 5 minutes for break. Okay, let's us continue. Integrated care for older people. Now we have a new problem, population aging. We develops. It is maybe good effect of health care, and all of us wants to live longer. But long living, uh, accept positive influence to our life and to our mood, has negative influence also because have many problems. And we have aging population. For example, few years ago it was only certain percentage of total worldwide population which are over 60 years old. And in 30 years, we believe that will be already 21% of aging of population who is after 60. And we programmed it. We know about this problem, and we have to do something to be ready to this growing of aging population, of older population. Now already we have more older persons compared with, for example, 50 years before. That's why we have to think about future and to change our services. And another problem which is due to population aging, ratio of workers to pensioners. In 1900, ratio was 6 to 1. So 6 persons who works and only 1 person who is pensioner. In 2000, it is 4 to 1, and now it is 2 to 1. So it is problem, big socioeconomic problem, big problem in caring of these older persons. And many scientists note about this problem. And in 2015, the International Society of Quality in Healthcare, including representatives from 16 countries, met to discuss the implication of rapidly aging population. They called for major changes in the delivery of health services, the structure of healthcare organization, the use of technology and systems to support healthcare delivery, the attitudes, expectations, and competence of care providers and patients. So all these big problems, they are not only medical problems present nowadays, and we have to do something with it. All these elderly persons need care and need good care, good quality care, and need good specialists for their health, for example, if we are speaking about doctors. And now, something in 3 years, World Health Organization make guidelines which call integrated care for older people. And in these guidelines, they are speaking about task of healthcare of older aging population and problems and mechanisms how to resolve these problems and new scientific research which we need to resolve these problems. What do World Health Organization write about? The primary healthcare approach has a key role in meeting the holistic needs of older adults. So primary healthcare in this place have to be specialists who knows about older adults problem. Action toward delivery of integrated care for older people can take place at all levels of health care. firstly in primary care, but at all levels of healthcare also. Information and communication technologies will help in training healthcare workers to provide personalized care to allow older people to do what matters most to them in the later parts of their life. So we already talked about it that older people have more problems with, especially with their health, with their mobility, with their mood than younger persons, and we have to be aware about it. And information and communication technologies, computer technologies, may help us to keep information and to send it to other specialists and to know more about problems of this older person. The responses to the health needs of older people include supportive policies, plans, and regulatory frameworks. So it shouldn't be short-term period of helping to older persons. It should be plans which include uh, years of patient's life. In addition to face the increasing demand for health care by the growing number of older adults, a fragmented care system have to be replaced by person-centered, integrated care that has primary care as a central element. So, in older persons, there are multimorbidity and social problems also. So it is very difficult to treat in a specialized hospital, for example, in cardiologic center, in neurologic center. For older persons, have to be many specialists, even not only specialists in medicine, not only doctors, social workers and other specialists in the same place to take proper care for older persons. And this should be put it should be done person-centered integrated care, which includes undertaking a comprehensive assessment that can assess the health and social needs of older people. First of all, complex assessment. Empowering and guiding individuals, families, and communities in the management of their health system, in decisions about their health care, and in their ability to take care of their own health and the health of those they care for. So you have to tell to community that we have this problem and we have to think about this problem and to resolve this problem together. And I already told you this term, multimorbidity. Multimorbidity is the presence of multiple chronic conditions at the same time and is increasingly prevalent, and multimorbidity is increasingly prevalent with age. Older people can develop geriatric syndromes such as frailty, urinary incontinence, propensity to falls, which do not fit into discrete disease categories. Really, frailty is due to nervous system problem, due to muscle problem, due to joint problem. Urinary incontinence may be, for example, due to infection, due to muscle wasting, and so on. Propensity to falls also due to different type of problems. That's why we have many problems in one person. Today, population demographics have shifted, yet there is little clinical focus on problems that matter to older people, such as chronic pain and management of ongoing difficulties with hearing, seeing, walking, or performing daily activities. Also, there is often a lack of protocols for preventing and managing geriatric issues such as frailty, urinary incontinence. Early markers of decline in intrinsic capacity, such as decreases in gait speed or muscle strength, are often not identified, treated, or monitored, although these actions are crucial if decline in capacity are to be reversed or delayed. So we shouldn't forget about this problem because we have many elderly persons and the amount will increase with year, and we have to know about their common problem, and we have to know protocols how to reveal problems uh, at the initial stage, and general practitioners have to know about it, and also should be in polyclinics geriatricians who knows a lot and who can help to other doctors to recognize these problems. Yes, this small uh, female really has many problems, and we have to worry about her, to help her commonly, to give her good quality of life. The physical infrastructure of many healthcare settings is not well matched to older people's needs. There are many problems nowadays, and we'll discuss about these problems now. Examples of infrastructure issues include a lack of accessible toilets for elderly persons with moving problems, long waiting lists, also very big problem, especially in poor countries when there are not enough doctors. Physical barriers to access if a person has movement problem, and communication barriers resulting from a lack of accessible information for people with hearing loss and visual impairment. Yes, not everywhere we have some mm, announcements with big letter. We have no audible announcements mostly in the hospital, and very difficult for people with visual or hearing problem to find proper place, proper doctor. Uh, the shortage of affordable transportation to clinics is another major barrier to accessing healthcare, especially for older people who live in rural areas. Yes, it is true, and I think all of you knows about these problems that very commonly older people do not go to the hospital because it is difficult to move them. They need some special transport and very difficult to find it. It is not cheap, and due to it, mostly people don't go to the doctor. Finally, healthcare and social care are typically fragmented from one another. So all older persons need uh, social care also. Uh, uh, for example, some money, some mm, nursing houses, some hostels, and maybe some other social care. And doctor have to have good contact with social workers. And yes, you see, this person has many problems and she doesn't know how to resolve it. She has problems with movement, and how to reach doctor is very big problem for this person. Numerous healthcare workers may be involved with one person's care, especially in countries with extensive availability of medical specialists. Of course, in more rich countries, more good health care. And now we'll discuss the way which they are recommended. Numerous healthcare workers should be involved with one person's care, especially in elderly persons. The social care sector is often involved when older people experience significant decline in their capacities and need help with activities or daily living. Health and social care services for older people are typically provided in more diverse settings and with greater frequency than is typical for younger population. And we have to develop this social care sector because we have growing older population. Families and other unpaid carers often play substantial caregiving roles, and we should to cover it. We should to remember about them, and maybe give some free times if they have older relatives. Free, maybe less hours in their working place or something like this to help community to develops to help to make good um, situation, good living conditions for elderly persons. Of course, these elderly persons need help, need help of family, need help of all of us. And one more problem is person-centered care for older people. We already discussed it. This person, we shouldn't speak about special disease. Now we have infection disease department, neurological department, cardiological department, gastroenterological department, and so on. But older people have many problems together. And person should we should develop in for them person-centered care. Focus on the older person's need and goals. All elements of an integrated care approach for older people remove around each older person's unique needs and goals. So we have to discuss about patient, not about disease. We have to discuss about this patient. Integrated clinical care. Integration at the level of clinical care is especially important for older population. This includes a comprehensive assessment, a common goal, and a care plan that is shared across all providers. And have to be teamwork of the many specialists for one person, and it should be coordinated with each other. And also health system alignment. World Health Organization has identified key building blocks of health system: service delivery, human resources for health, health infrastructure, products, vaccines and technologies, information and data, leadership and governance and financing. No, it's of course not a task for doctors, but it is a task of country to develop health system alignment, especially for future when more and more elderly persons will be in each country. And after, when we resolve this task, our elderly persons became more happy, became, will have good quality, more good quality of life. Of course, they will not be healthy, but will have less problems with their health if we'll care about them. And what primary care providers can do. World Health Organization mostly focused on primary care providers. Of course, the World Health Organization may only recommend to countries to develop health care for elderly persons. But more strong recommendations are for doctors, for primary care providers. Use case management strategies. We already told person-centered care. Case management strategies include comprehensive assessments, care plans, and proactive follow-up. So if you have elderly persons, you have to work together with other specialists, make plan for a future, and then be active in follow-up. Sometimes visit this person, or ask his relatives to move this person to you to control the treatment. Implement evidence-based clinical intervention tailored to level of intrinsic capacities. No, of course, better to use after when you have proper diagnosis, you have to do proper intervention, which are special for each person. Work collaboratively with other providers. I already told about it. No, and first of all, you have to be uh, just you have to be very kind and polite with elderly persons. In this case, you both will be more happy and you will help more to her mm, and give the best for this elderly person. And we'll speak something more about each point. What means evidence-based clinical interventions? For older people with high and stable levels of capacity, the goal is to build and maintain this level for as long as possible. So there are different um, types of intervention in different situations. Patient, elderly person may have high and stable levels of capacity. Diseases are chronic but without exacerbation. In this situation, you have to keep this situation as long as possible. For older people experiencing declining capacity, healthy behavior remains crucial. You have to think first of all about patient physical activity, about patient diet, and healthy behavior may help patient to stop declining capacity or to make it more slowly. For older people with significant loss of capacity, the twin goals are to optimize clinical trajectories and to compensate for these losses through the provision of social care services. It is most severe situation, loss of capacity. Clinical interventions includes ongoing disease management, rehabilitation, palliative interventions, and even end-of-life care. You shouldn't forget that in older persons, very important palliative interventions and end-of-life care. We have to give care to all of them. What means case management strategies? Conduct comprehensive assessment to provide the information needed to prioritize and tailor interventions. Many problems, and you have to decide which problem is most important or problems are most important. Because if you treat many problems, will be side effect of each drugs. You shouldn't give many medicine to one person, especially older person, because it will lead to loss of effectiveness and development of side effect. Set care goals together with older persons involved with decision making and goal setting from the outset. Of course, you have to discuss with older person, especially if he or she has good mood, which problem disturb him more, how much money does he have, which problem he can resolve. So it is team decision, and in this team is included older person. Develop and use integrated care plans. Many problems you have to have general line for treatment. For this, you have to do integrated care plans. Provide systematic self-management support with the information, skills, and tools that need all the people to manage their health conditions, prevent complications. Provide regular and sustained follow-up. I already told you that maybe you have to visit an elderly person yourself actively because they can forget about to visit the doctor. They may not pay attention to this situation. And how World Health Organization recommendation for primary care services organization and delivery. Implement active case finding. Not only follow up patients who come to you already, try to find yourself in population who is living nearby the polyclinic, elderly persons, and ask him to come and to make common investigations and to find their problem and follow it. Use multidisciplinary team. Share information across providers, setting and time. Electronic health recorders. Yes, we need computers to send information to other specialists and to receive it in time. Prioritize community and home-based care. Locating health services close to where people live is especially important for older people. Yes, we have to have more health services because if there are only few, very difficult for older persons to reach it. Accessible and affordable public transportation to healthcare facilities should be available. We discussed about it. Home visit delivered by healthcare providers and hospital at home services can have positive effects for older people. And engage communities. The community include families and household, employers, religious organizations, the physical and social environment, and community organization of different types. And all of them have to be involved and have to be engaged. If we will do it everything, our older people will be happy, will love us, and will help us to be happy also. Thank you for your attention, and remember that old age is full of delights if only you can use it. Thank you for your attention, and goodbye.